Hey there, hope you've been well. Welcome to this channel and thank you for tuning in. Today we are going to look at pharmaceutical care and we are going to learn a number of things under pharmaceutical care and we need to appreciate what pharmaceutical care plan is. We already have a lecture on this channel about pharmaceutical care. We request you to kindly follow up and check it out in the channel so that before actually you watch this specific one. In case you have any issue on the color, the choice of the color, we are sorry because some people prefer specific colors. All right, we shall improve better next time and choose other colors. Though we tried out to check out whether there are some who like that color. So, pharmaceutical care plan, there are various actions that comprise the application of our pharmaceutical care to individuals. The different actions that you take that comprise the application of this pharmaceutical care that we have already discussed to your individual. And your individual, we are looking specifically your patients and your clients. So if undertaken in a role or in parts, they will result in added value to drug therapy by making a positive contribution to the safe and cost-effective use of drugs, leading to positive outcomes and improved health care. Okay, so when we look at this picture, what do we see? Basing on you're seeing books, you're seeing a calc or like a phone somewhere, and then a person is having a pen, and then yeah, so many books, papers before him or her. Okay, basing on how you see the cartoon before you. So we see that when you're developing a pharmaceutical care plan, you have to document it down. For most cases of the patients, you need to document it down so that you are able to follow it up. You're able to intervene on what you have done. You're able to have a decision made, okay? And you're able to evaluate because if you don't write it down, we have so much busy schedules and you can end up forgetting what you wrote and how you handle these patients. So that's why even in hospitals, in facilities, we prefer the use of prescription so that it is documented down. The patient history is documented down. The medication a patient is supposed to take is documented down. The impression a person has got before maybe carrying out the different tests is also noted down. Okay, so you find that when you write down something or when you document it down, you are not likely to forget what you have documented down or written. Okay, so it has to be written most of the time. However, we may have cases that you may not have to write it. So we're going to look at what is that patient care planning. How would you plan for your patient? The person that we have looked at in the previous slide is actually trying to plan maybe for a group of patients or for a specific patient that needs special pharmaceutical care to be offered to them. So it involves this procedure of patient care planning. We see that it involves systematic assessing of your patient's healthcare problems, assess your patient healthcare problems and their needs. After you have assessed their health problems and needs, you look at setting objectives basing on what you have assessed or you have found out about this patient problems and needs, and not necessarily maybe family problems, social problems. You're looking at the health problems of the patient. You may not solve financial problems of the patient, but we are focusing on the health problems that these patients may be like undergoing or facing. So you set the objective. After setting the objective, you perform interventions. Like different interventions have to be performed, and then there should be evaluating or evaluation of results. After you have assessed the problem, you set objectives, you have intervened in the problem. So you look at how did it go. That is now the evaluation of your results. Not all patients require patient care planning, like a written one. Others, you may handle them without writing or documenting it down. Pharmacy technicians must assess their own patients and identify specific areas or on which to focus. Like you have to assess your patient, and during your time of performing intervention, you should be in position to know which areas I need to put more emphasis. So we have steps that you need to use to summarize your patient care planning, and you can involve the format, the SOAP. Okay, SOAP is not the soap we use. We are going to look at in the next slide what this SOAP represents. This is just put so that you are in position to remember them in your exams easily. So we see that S stands for subjective information. That is what did the patient tell you about themselves, about the problem they are facing. And then objective information, what can be measured by the care provider or objective information available to the care provider. A stands for assessment of the problem, what the care provider thinks is the current status of that problem. And then you have to plan. What do you do? After finding out all this information about your patient, you plan the diagnosis for this patient, and then therapeutic interventions that you're going to offer to the patient. You have to plan for it, and then monitoring of your patient or other interventions to address the problem that has been presented to you. So we are looking at steps at a time. We say there are 5 steps that you need to have or need to know when you're preparing your patient care plan. So you say that you should gather an accurate medication history about the prescription, or including both prescription and non-prescription medication your patient has been taking. This is the information you need to gather. We likely also have to obtain some information from the physicians, such as the lab test results and hospitalization of the patient. You should also be able to get written permission from the patient before soliciting this information. Like you need to get consent from the patient. Okay. Once this information is compiled, the preparation of the patient care plan can begin or can start. So the second step in the process is identifying the problem. Collection and evaluation of information that we already gathered in step 1 for identification of drug therapy problems, like that information you are collecting or you were collecting basing on the current situation. It can be a past or in the future, or like you are already doing it in that time. So allows for identification of drug therapy problems. From the patient's medication profile, all the patient's problems should be listed in it. Subjective and objective findings should be correlated to the listed problems. And then subjective findings are those that the patient describes. For example, I feel tired all the time, I feel bloated, or I woke up coughing. Okay. So objective findings are those that can be observed or measured by technicians, like you can see them and you can measure them. Step 3, after you have done those 2 steps, you assess the problem. The main goal is to establish a full medication history before you intervene into a patient's condition. Highlight actual and potential drug-related problems that may arise: drug interaction, drug-drug interaction, drug-food interaction, something like that. Drug-related problems may arise when the drug use is not optimal. If this medication is not used right, what problems are likely to occur. You also have to inform the patient about this in case there are any issues that may arise when they do not adhere to medicine or comply to medication or the treatment that you have given them. The technician analyzes and integrates the information gathered in step 1 and step 2 and draws a conclusion in preparation for developing a patient-specific patient care plan or pharmaceutical care plan. So this is an example. If a patient is suffering from asthma, the technician may first investigate the etiology of the factors that exacerbated the asthma. Does not have to involve in skin testing, because we are looking at when you look at etiology of asthma, you may not look at the skin testing. Like, why would you test the skin? Yeah. Nor does the technician have to conduct a detailed, extensive history of all the factors that may have precipitated to this asthma. So we are still on step 3. However, the technician should attempt to determine if drugs, for example, NSAIDs, aspirin, or B blockers could be exacerbated or could have exacerbated this asthma that your patient has presented with. Next, the technician assesses the severity of the asthma. This could be accomplished by determining the PEFR, examining the patient's daily symptoms, and the peak flow daily. That's daily. So for you to do that, you need to have good consultation skills. And what do you need to have good consultation skills? What should you portray? You should be active listener. Listen actively to all the information. Listen to your patient. Appropriate use of open and closed questions should also be used. Respect your patient, no matter who they are, a child, elder, your age mate, something like that. Give respect to the patient. Every patient desires the best. Every patient beneficence do good to all your patients. Okay, it is an ethical principle that you need to do good to all your patients. And how do you do that? You respect them. Avoid jargons. Avoid using jargons. Avoid using not alphabet. They call them, I think, abbreviations. Yeah. Avoid using abbreviations. Demonstrate empathy while you're handling your patient, and then deal sensitively, potentially, embracing oral sensitive issues, embracing and sensitive issues. So this is like a process, a consultation process. You can pause the video, has the elements, the goals, and then examples of associated competencies. In your free time, you can pause this so that you get all the details, okay, of the procedure. So that continues. See here, we have relevant patient details that you need to have in your history. You need the age, gender, ethnic or religious background, social history, presenting complaint, working diagnosis, and then the previous medical history, laboratory or physical findings. You need to know that. Step 4, developing the plan. This should state the goals to optimize care, should state the responsibilities of both the pharmacy technician and the patient in attaining the stated goals. Like when you're making a plan, what is your role? What's the patient's role? And what goal are you aiming at attaining? What objectives have you set? Okay. So the technician establishes goals linked to each of the patient's problems and specify a course of action aimed to meeting each of the goals. So each goal or desired improvement should be stated in terms of measurable outcomes. Like things should be possibly done. Like they should be in position for you and the patient to do. there are some things that are not measurable, and the outcomes are not measurable. Like, they cannot happen, they cannot exist. Okay, for example, if we have a patient presenting with a condition that is not curable, and then you are telling them, I'm going to give you a medication that is going to cure it, you know that is not possible. Okay, you can only manage the physiological function of the patient to maintain them, but you cannot cure what? The condition. Step 5, evaluating the achievements of the outcomes. Outcome assessment is a process through which a health worker analyzes the patient's signs and symptoms together with the physical findings to enable him or her arrive at the correct diagnosis and treatment. This review process against the stated problem outcomes. So outcomes that will be used to evaluate the success of a patient care plan or a treatment plan must be meaningful, measurable, and manageable. Okay, like set things that can happen and should be measurable and attainable, by the way. So we are continuing with our step 5, and we say there are 5, so we are in the last step. So we have an example. The outcome listed for asthma for a patient in the previous slide. We see that the outcomes listed for a asthmatic patient would include, but not be limited to, lower frequency and severity of the acute exacerbation, fewer physician's office visits. Like, these are things you may not, like, not achievable. Like, this patient has to always visit. Elimination of side effects, okay, and then fewer emergency department visits, and maintenance of activities that enhance the patient's quality of life and may have been limited by the disease. So documentation should include these components: patient data such as the name, medical records, like these are the data for the patient. Then the name of the technician responsible for developing and implementing this care plan. Then patient problem listed individually in order of the potential pharmacotherapeutic impact. Like, put the patient's problem there. When did the patient come? The date on which a patient problem was identified. Many diseases remain chronic throughout the patient's life, and you need to assure them about it. So problems such as urinary tract infection or upper respiratory tract infections usually resolve in the period of 10 to 14 days. So examples of pharmaceutical care plan, like examples, these are some of the examples. We see that the name, we have seen the name of the patient, we have seen the condition a patient is presented with, what's the drug that they have, drug of choice they gave, and then the strength of that drug and the regimen of the drug and the quantity that you gave to the patient. So this goes back to our asthmatic patient. All right, sorry for that. So you find that this is how it may look like, the documented pharmaceutical care plan. This is how it looks like. You can pause this video so that you understand this slide properly. It continues up to here, and this brings us to the end. Thank you so much for listening to Grapharm Academy. We love you all, and we wish you a great time in learning. So in case you came this far and you didn't understand anything from the start, kindly put it in the comment section and we shall be glad to respond to you and give your feedback and or maybe make another video so that you understand and comprehend. In case you dozed off along the way, also thank you for reaching this far. Yeah, we are glad that you woke up again. All right. Have a nice time. Please subscribe, like, and share to content in this channel so that we are in position to make more videos like this, and together we can stay blessed.